remedy from Borix Remedica. In fact, it is again a very important remedy from the practice point of view, and that is Symphytum. Because this remedy helps you in many aspects. Generally, Symphytum was considered to be only a remedy for the fractured bone, non-healing fractures only. But this is not so. There are many uses of the Symphytum. And basically, whenever the patient comes with an eye injury or injury to the eye with a nit of the fist of the child to the nursing woman, whenever that injury affecting the cornea, Symphytum is a very important remedy. And it has many more uses. Even in ulcers, the Symphytum plays very important role. Even in pruritus, it plays very important role. So why not to learn this remedy, the different aspects of Symphytum. It looks very small in the Borix Remedica, but every sentence gives you a detailed idea about this remedy. And that's why today we'll learn this Symphytum. A compre, which is also called as knit bone. Knit bone is a common name because it needs the bone. Whenever the fracture is there, it needs the bone, and that's why this name is there. The root contains a crystalline solid that stimulates the growth of epithelium on ulcerated surfaces. So ulcers are healed with the help of this remedy. This is ulceration which is generally recovered with this help of Symphytum. It may be administered internally in the treatment of gastric and duodenal ulcers. See, this is very important. We generally never think of the gastric ulcer, duodenal ulcer, the Symphytum. Whenever we think, we generally learn Remedica in the manner that we fix certain things in our mind. We generally think of Kali bichromicum whenever the peptic ulcer is there. But it is not so. There are many more remedies which have ulcer, and Symphytum is one of them. And Symphytum is a remedy which has a capacity to heal that ulcer. Also in gastralgia and externally in pruritus ani. See, this is gastralgia, gastric ulcer, peptic ulcer, duodenal ulcer, gastralgia, inflammation. All those things are covered with it, along with external pruritus ani. So this is very important remedy in pruritus ani, like Sabadilla, like Sina, wherever the worm infestations are there. This is without worm infestation, the pruritus ani is there. Injuries to sinews, tendons and periosteum acts generally on the joints, neuralgia of the knee. See, this is again one important thing which you have to find it out with the Borix. He defines the action of the remedy. So he defines it. It is very specifically on the tendons. It is very specifically on the periosteum. It is penetrating injuries to the periosteum. The Symphytum plays a very vital role. It acts on joints generally with neuralgia of the knee. Of great use in wounds penetrating to the periosteum and bones. This one should underline. This is the key of the Symphytum, and I never failed with the Symphytum. There are many orthopedicians I have also observed. They used to prescribe Symphytum for the fractured bones. They used to prescribe Ruta for that. They used to prescribe Arnica. They used to prescribe Calcarea phosphorus. Because in modern science, there is no specific medicine for healing of the fractures. For injury, for healing, there is no medicinal agent which we have in homeopathy. For wound healing, for production of granulation, the calendula is there. In the similar manner, for the healing of the fracture, the Symphytum is there. Calcarea phos, Symphytum, Arnica plays very vital role in fracture, healing of the fracture. So, of great use in wounds penetrating to the periosteum and bones, and in non-union of fractures. It is given in italics. I will share one case. He was the patient with me with avascular necrosis and cured with me with homeopathy. He was absolutely normal, doing all his activities. He stopped homeopathic treatment for 4 or 5 years, and all of a sudden, one day he had he had an accident, and he had fractured his femur. The shaft of femur was get fractured. So he was admitted over there in Srirampur. Then he was shifted to the Ruby Hall. Then there was a operative performed over there, And after operation, after 3 months of operation, they took the recurrent X-rays and they found it is not getting healing. Then they suggested that he should go for another operation where they will do the bone grafting over there. So this fellow who was knowing me, because I have treated his avian, so he came to me. I observed all his X-rays and his condition, and I have started him on Symphytum along with the arnica, along with the Calcarea phos in biochemical potency. And it was continued. I asked him, don't go for a further operation, we'll wait for 2 months and then we'll take another X-ray. If needed, then we'll think about the surgery. And what happens after prescribing these remedies, and it was continued nearly about 2 months, and after 2 months when X-ray was taken, there was full of callus. A callus was formed and it was healed completely. So this is very important remedy for non-union of fractures. Irritable stump after amputation. This number of people never knows. If there is a fracture of the part of the leg is totally taken out, whatever is remaining part is called as a stump. If it is irritable, if it is so painful after an amputation, that pain can be stopped with the Symphytum. If there is a neuralgia after that, one remedy I know and all of you know is a very common remedy is allium cepa. In allium cepa, there is a neuralgia of the stump after amputation. Here it is an irritable stump. Sometimes it is more painful in cases of Symphytum. Irritable bone at the point of fracture. So this relieves the pain also at the site of fracture. Psoas abscess. What is psoas abscess? Psoas abscess is a cold abscess. Generally it is tuberculosis. It is a tuberculosis of the which used to produce an abscess and which settles down in psoas over there, psoas muscle. It is called as psoas abscess, not having any single quality of the acute inflammation. That's why it is called as a cold abscess. So this remedy is a deep-acting remedy. It suggests that it covers the tubercular miasm. Pricking pain and soreness of the periosteum. So type of pain is pricking, very characteristic. Soreness, it is as if some trauma has been happened over there. That type of pain is always present with Symphytum. Head symptoms, pain in occiput, top and forehead, changing places. Pain comes down of the bone of the nose. So it is bony penetration in the nose. Up to that level the pain comes in Symphytum. Inflammation of inferior maxillary bone, hard red swelling. So inferior maxillary bone, where you get hard painful swelling, that capacity is there with the Symphytum to penetrate. So it is a very good remedy for the maxillary sinusitis other than calibichromicum. Eye symptoms. This is what I have explained you at the start of my lecture. Pain in the eye after blow of an obtuse body. This is too important remedy for eye injury. Very important. Blindly think about Symphytum, giving Symphytum to the patient whenever injury to the eye. I have cleared many of the patients of eye injury with the help of Symphytum. For traumatic injuries of eyes, no remedy equals this. This is what Boris says, and this is true, and I have practically observed that in my practice. Relationship, compare arnica and Calcarea phos. I will suggest that both every remedy plays their role. Arnica is blunt trauma is there. Even for the fractures, arnica is important. I never prescribe Symphytum separately in arnica. I used to prescribe if there is a fracture and injury is there, both types of trauma is there. For the healing of the bone, the Symphytum is necessary to form the callus. Arnica is necessary for the whatever the hemorrhage or which is there. Sometimes there is petechial hemorrhage, sometimes there is a chemosis to absorb that blood. This remedy, arnica, is necessary, and even it removes the pain very quickly. It stops the bleeding. That's why arnica is also important. And Calcarea phos in the fractured bone in biochemic doses, it is very good remedy to form the callus. So callus is very easily formed with the help of Calcarea phos. So I used to prescribe all three remedies. I never think about the single remedy, single dose, and I never believe in such types of cases because it is not a dynamic disease. Accident is not a dynamic disease. Accident is accident where trauma is there, and you have to do homeopathic management. You have to manage that patient. Here you don't require it. just to take the totality and find it out one remedy and prescribe that remedy. What is needed is the action, and your action plan should be proper, it should be logical, and it should work in a proper manner. So this is too important. Arnica and calcarea both are needed in such types of cases. Dose here they have mentioned tincture, but I used to use it in potency. Generally I used to prescribe 200 potency or 30 potency in fractured cases. I never used the tincture of Symphytum. Externally as a dressing for sores and ulcers and pruritus, but this aspect I have not tried in my practice, the external application of Symphytum, but I have used Symphytum very perfectly with the potencies 30 or 200 in repeated doses. So repetition is necessary. Single dose is not important because ultimately you have to stimulate the bone formation over there. So callus formation, it requires the stimulation. So this is Symphytum. This is a good remedy for us to utilize in practice. So that's all for today. Thank you very much.